Hi there, welcome and bienvenidos to everyone. My name is Oscar Raul Lopez, and I work as a consultant for NASTAD, and I run a Latino-specific organization on the U.S.-Mexican border with influence on some of the decision-making at the national level, which we're very proud of. Today, I'm here to speak to you about how to improve engagement with Latino communities. The objectives, just so we can go through those, are we want to increase the understanding of the value of language and terminology, such as Latino, Hispanic, Latinx, the importance of knowing your audience. We want to increase awareness of ongoing negative HIV health outcomes for Latino communities, increase the understanding of methamphetamine use and its negative impact on Latino communities. And that impact is huge, so we will discuss at greater length. Increase understanding of machismo and marianismo, and how to convey respect as needed, understanding who manages the family's health outcomes. Regarding the U.S. Hispanic population, in 2019, the U.S. Latino population reached 60.6 million. 36%, are immigrants, like myself, born in Mexico, smuggled into the United States as a baby. 34% are second generation US born with at least one immigrant parent. 30% belong to third and higher generations, US born to US born parents. And how that is impacted their access to wealth, to education, to healthcare has a lot to do with this as well. About half of Latino adults say they most often self-describe by their family's country of origin, again, as I described, Mexican, Cuban, Puerto Ricanos, Salvadoreños, while another 39% most often self-describe as Hispanic or Latino. There's 56% of foreign-born Latinos most often use the name of their country of origin, 39 among the US-born adults of children, and 33 among those of third and higher generation Latinos. Then the focus moves over here. When we've all needed this education, maybe at different amounts and different times, at different levels of education, etc. But because we've been segregated and it's been determined by somebody else who gets what when, meeting that goal is proving to be very, very difficult. Regarding MSM, men who have sex with men, trans Latinas, and immigrants, men who have sex with men present the largest affected population. 80% of HIV incidence among Latinos is within the MSM community. Since 2010, new annual HIV infections have increased by 30% for Latino MSM and by 68% for MSM aged 25 to 34. So oftentimes we think, though they're too young to know, etc. It is estimated that roughly 1 in 4 trans Latinas has HIV. Latino immigrants account for at least 1 in 3 new HIV diagnoses. That's a really large number. Importantly, evidence suggests that most foreign-born Latinos with HIV have acquired the infection after living in the United States, as opposed to bringing it in, which is often assumed. Machismo refers to the sense of being manly and self-reliant, the concept associated with a strong sense of masculine pride. An exaggerated masculinity that can excuse promiscuity as manly behavior and ignoring high-risk behaviors because of invincibility. But unfortunately, that sort of vision and interpretation of what it means to be macho has changed. Machismo can encompass positive and negative aspects of masculinity, including bravery, honor, promiscuity, dominance, aggression, sexism, sexual prowess, and reserved emotions, amongst others. For many men, the pressure of being the provider, the protector, and not being allowed to share their fears or vulnerabilities can be very harmful to their health. And it usually takes a multi-generational household in tune with this to allow fathers and grandfathers to grow and seek out healthcare and admit their shortcomings and ask for help. Machismo and caballerismo. With each new generation of acculturated young Latino immigrant males, there's a growing number moving away from machismo, as I mentioned, and encompassing images of male gender role characteristics such as chivalry, bravery, and family provider attributes, what we call caballerismo. Homophobia is motivated by the dichotomous view of sexuality, where a gay man is perceived as feminine, thus denied a given source of power that most men have or have been given. This sexist view is enhanced with men who are anally penetrated during sex, by virtue of which they adopt a woman's role, or assume to be a woman's role, and are thus subordinated, because we all know women who are always in control. But this is the viewpoint of many Latino men about those who receive anal penetration. Sexual partners become boxed in by their sexual roles, and research conducted with MSM in Mexico suggests that this sexual dichotomy socially divides men based on their sexual preferences. Those men who prefer to be anally penetrated were more stigmatized socially than their counterparts. The dichotomy of the product of heteronormativity, the dichotomy is a product of heteronormativity, it's been a long day, and the expected passive role of women and the aggressive expected role for men. Regarding testing in our immigrant men, many immigrant men perceive sexual health service seeking as emasculating, oftentimes because the facilities look like they're geared towards women. HIV-related services are associated as being for sexual minorities or women because images, signage, public perception of the facility, as well as the conflation of sexual and reproductive health services, including HIV and STIs screenings, purposely exclude heterosexual men who don't feel like they fit into those roles. In one state that I visited, a healthcare facility, the only signage outside of the building, so you knew which entrance to go through, said STD building. Because it was carved in stone, it was never replaced. And you literally had to walk under a sign saying STD in order to get care. And anybody who saw you on the busy thoroughfare and recognized you knew something was up. Home and mobile testing have high home and mobile testing have high acceptability and reach more migrant and immigrant men and their partners than health facility-based approaches. For men testing positive for HIV and provided with immediate antiretroviral therapy, don't make them wait a week or two, is credited with high retention and viral suppression, as well as giving providers more immediate access to their partners, potentially to unborn children or infants who may also need HIV testing or treatment. Regarding Latino Msm, many of us are encouraged to keep our relationships, our sexual encounters hidden and clandestine due to Catholicism, gender norms, and heteronormative culture. Many of the men in relationships that I'm familiar with have all been exposed at one time or another to an STI or to HIV by their significant other. And they just didn't feel safe enough to ask the questions or to inquire about their perception of what was happening. HIV interventions developed for US and foreign-born Latino MSM must consider the potential for homophobia, racism, and discrimination to be part of Latino gay men's everyday lives. They must respond by developing programming oriented towards decreasing it, to diminishing discomforts and emotions, and reduce the probability of unsafe sex practices when clients are made to feel lesser than. Gender stereotypes. The way Mexican MSM regard anal penetration is affected by gender binaries, heterosexuality, and particularly homogenic models of masculinity that build sex between men as analogous to heterosexual sex. In the same sense, the data from this Mexican study that we're going to share reported a similar ambivalence where men expressed gender stereotypes but not always lived up to them in their sexual encounters, which reflect ambiguity and diversity in how masculinity is lived. However, the social stereotypes remain in place. Sexual practices and identities are built on two sole options that not only describe the sexual actions, but the undimensional character and identity that carries it out. The active partner may seem be able to keep his masculinity trait because he penetrates. The passive partner is subordinated or assumed to be a subordinate, and therefore has a feminine status. For masculinity, this signifies a loss of patriarchal privileges that stem from helogenic masculinity. This cultural discourse not only reduces sexual practices to two options, and only two options, but makes being versatile, the idea of moving freely between two sexual practices, also restricted. Now, we're going to talk about meth prevalence among Latino MSM. The prevalence of methamphetamine use among MSM has been shown to be 20 times that of the general population, with an estimated 10 to 25% of MSM reporting use of meth in the context of sexual behaviors within the past 6 months. Epidemiological studies among US MSM over the past 5 years demonstrates that the prevalence of problematic meth use has remained steady. Meth remains affordable, simple to manufacture, and readily available. The impact of meth on internalized homophobia. For many Latino MSM, emotions such as fear, nervousness, anticipation, and guilt are very much present before, during, and after sexual encounters. Emotions that are mixed with a sense of physical and emotional pleasure of having sex with another man. It is this stigma and discrimination combined with pleasure and sexual satisfaction that mostly affects gay men's identities, desires, and sexual experiences. The heart and body may know what the individual desires, but religious, familial, societal, and gender expectations weigh heavily on many of us. When exposed to the stigma-free sexual desires that accompany meth use, many men are conflicted between understanding the health and legal risks associated with meth use for sex and the euphoric, stigma-free sensation of sex exploration. MSM use crystal meth at double the rates of other populations. For many who indulge in sex and meth, become interwoven until they can't be separated. Under the influence of meth, users may become completely uninhibited and inadvertently put their health at risk, and are more likely to put their health at risk, are more likely to be exposed to HIV and/or other STIs. Encouraging meth using MSM to get and stay on PrEP should be a priority for all HIV programs. The core issue for MSM and meth use are the same as they are with most things gay and bisexual men struggle with: shame, fear, intimacy, body image issues, internalized homophobia, perfectionism as it's portrayed in media, whether it's magazines or film, television, and the compartmentalization that occurs for our people. If you're an MSM of color, you can add internalized and externalized racism to the list and marvel at how all this baggage easily pollutes what should be natural human sexual energy. The prevalence of meth among HIV-positive Latinos is linked to an increase in sexual partners. MSM who report having 4 or more male partners are twice as likely to contract HIV in comparison with MSM who report fewer partners. Among MSM living with HIV in the United States, meth rates are reported between 23 to 35% and 20% among Latinos, but that number is climbing quickly, especially with COVID and the loss of low-paying jobs, blue-collar work. This disinhibitory nature of meth makes it an appealing tool for aiding sex. Many use it to enhance their senses, increase energy and stamina, increase confidence, reduce anxiety, and making sex more fulfilling. For many MSM who experience discomfort or shame when engaging in penetrative anal sex, meth allows the user to feel uninhibited. They report feeling sexy, desirous of penetration when high, and for many, being able to engage and derive pleasure from something they have grown up understanding was shameful, penetration, or a non-masculine act. Takeaways and recommendations regarding that: emphasize harm reduction, messaging, and non-judgmental approaches to drug use, offer support and not judgment. We're going to show you some posters in a second about that. Create safe spaces for Spanish language speakers and utilize cultural competencies about machismo and mistreatments when interacting with Latino populations. Invite shareholders and community voices to the table through outreach and network building to bolster Latino representation within healthcare delivery settings and to help develop programming. Train all your staff from your front desk to the doctors and management about the negative impacts of methamphetamine use. Also help them understand how the disinhibiting effects of the drug appeal to men who may feel more shame about sex, and how staff can help change community attitudes in their clinics and communities by speaking about it more honestly, by not whispering about it, until, once you get the awareness that the person is not ashamed or is willing to not be ashamed, then open up the conversation, because you may be the first person to be able to do that with them.